Thanks for joining us on the John Mendola Show. We are driven by McCarthy Tire and Automotive Centers. Well, let's talk with Dr. Alan Goldhamer, who's kind enough to join us and give us a little perspective on a little better and healthier life. Dr. Goldhamer, welcome into the show.
Oh, thanks for having me.
Well, the book, The Pleasure Trap, you and Dr.Doug Lisle wrote this book some time ago, and there's so much great information in there. Tell us a little bit about the book and what people are out there seeking as far as what they do with food and how their drive is a little bit and how they live.
Well, the pleasure trap represents a very common problem that people face. The subtitle of the book is Mastering the Hidden Force that Undermines Health and Happiness, because it turns out that this force is responsible for why people are fat and largely sick and miserable. The fact is that more than just about anything else, human beings are driven by pleasure. Pleasure is kind of the brain's reward for engaging in behaviors that favor survival and reproduction. It's a critical part of our biological heritage. It's necessary for our survival. It's how we and most of the other creatures that we share the planet with have survived. And in the natural setting of our ancient ancestors, this business about if it felt good, do it, worked really well. The two behaviors that are most critical to human survival is eating behavior and sexual behavior, if you think about it. You have to get enough to eat. You have to avoid being eaten long enough to reproduce. So it's not surprising that it's eating behavior and sexual behavior that are associated with this stimulation of our brain's pleasure cascades, the production of a chemical called dopamine. So dopamine is essentially the pleasure neurochemical. It's the thing that determines if something is pleasurable and to what extent or intensity it's experienced that way. So the more dopamine, the more pleasure. So if you engage in feeding behavior, your brain rewards you with dopamine, you feel good. If you engage in sexual behavior, your brain rewards you with dopamine, you feel good. And this system of rewarding our bodies from our brain's production of dopamine worked well until relatively recent in evolutionary history, humans figured out a way of gaming the system. They found out that they could artificially stimulate dopamine in the brain with exposure to certain chemicals. And the most obvious example of the pleasure trap is drugs and drug addiction. People like things like alcohol because if you drink alcohol, it makes you feel good, and people like that. The problem is because it's an artificial stimulation of dopamine in the brain, if you keep drinking alcohol enough of it over enough period of time, you can eventually become addicted or dependent on that artificial stimulation. Now you're having to drink not just to feel good, but to avoid feeling bad, kind of the hallmark of addiction. And we all recognize that, and we recognize that drug addiction can be a problem. We recognize that the only way that you can deal with drug addiction is for addicts, is to not use those substances, to quit drinking, quit using the drugs. And that, if that was the end of the story, we could just say, well, don't use drugs and everybody would be fine, and that would be the end of it. But it turns out it's not that simple, because there are chemicals that can actually be added to the feed supply that stimulate the same neurocascade as drugs. So, for example, if you take rats or mice and you put them in a cage and you let them eat ad libitum as much as they want, they get to a certain size. But if you put these chemicals into the rat chow or the mouse chow, those animals will increase their total body weight 49% in just 60 days. And the chemicals that we're talking about are oil and sugar, refined carbohydrates, these what we consider normal substances, but are actually not normal at all. If you think about whole natural foods, there are no concentrated oils or sugars or refined salts added to foods. And as a consequence, when you put these chemicals into rat chow or mouse or even birds, for example, the birds will get so fat they can't even fly, because those chemicals artificially stimulate dopamine in the brain of those animals just like drugs do. And, of course, it happens exactly the same in humans. And that's why today 2/3 of people are overweight, and we have an epidemic of chronic degenerative diseases, diseases of dietary excess, diseases that used to be called the diseases of kings, because only the wealthy elite could eat the kind of diet that caused them. The obesity, the cardiovascular disease, the type 2 diabetes, the autoimmune diseases like lupus and rheumatoid arthritis and ulcerative colitis and asthma and eczema, psoriasis. These conditions that used to be rare are now ubiquitous because we've put these chemicals in our feed, and now they make us fat and sick. And so the pleasure trap's about recognizing this trap, this artificial stimulation of dopamine that leads to disease and debility, and developing strategies to escape the pleasure trap. And it's difficult. Just like it's difficult for somebody to quit drinking that's an alcoholic, it's difficult for somebody to choose not to consume these chemicalized foods, especially for people that are overweight. And we talk about developing a vegan, SOS-free diet. SOS, of course, stands for the International Symbol of Danger, and it also stands for sugars, oils, and salts. But if patients choose to adopt a vegan, SOS-free diet, they lose their weight, and to a large extent, they can overcome these diseases of dietary excess. And that's essentially what our clinic, the TrueNorth Health Clinic, is all about, is bringing people in. We put them through a period of fasting to recalibrate their systems, and then we get them on a vegan, SOS-free diet until they get well. And it works consistently. If you go to our website at healthpromoting.com and you download some of our studies, you can see that we have the largest effects that have ever been shown in treating hypertension in humans, that is high blood pressure, through the use of fasting and a vegan diet. It works consistently, and it works more powerfully than drugs or pills or potions or the other things that are being advocated today.
Dr. Goldhamer, one of the things you hear Dr. Michael Clapper say, who's from TrueNorth Health, is that there's nothing better than a 21-day fast, or you see somebody on 21 days of just water, you see so many changes and so many things go away. And of course, you have people there sometimes are do it for up to 40 days.
Well, fasting, by definition, is the complete abstinence of all substances except water in an environment of complete rest. And we recommend that be done in a controlled setting like we operate at TrueNorth Health. And we do fast people from 5 to 40 days on water only. They say that Moses, David, Elijah, and Jesus fasted for 40 days, and so do some of our patients, so I guess they're in pretty good company. Fasting is a very powerful intervention. It can be an intense and miserable experience, but the net result is it allows the body to do what it does best, and that's heal itself. And, if you have high blood pressure, or you have diabetes, or you're suffering with autoimmune disease, or the conditions like lymphoma that respond well to this approach, there's really nothing that works better than doing nothing intelligently.
Dr. Goldhamer, how about a little background about you? People, they learn their eating habits. As Americans, we need to relearn how to eat. And kind of there's a pressure all around us. Sometimes it's from the people we love the most that we've, started these. How about a little bit about your background?
Well, I actually got interested in nutritional medicine and diet and lifestyle at the age of 9 years old. And it happened when I met Dr. Doug Lisle, who's the clinical psychologist at the TrueNorth Health Center. We've known each other since the 4th grade. And Dr. Lisle was very bright, but he was very annoying because he always beat me in basketball. And I thought, I'm going to become a better basketball player than him. So I practiced. But it didn't help because he also practiced. And he continued to beat me. And then I thought, okay, well, I started reading books. And I came across a book by Herbert Shelton. He talked about a vegan diet and fasting. And I thought, that sounds good. I'll do that, and that'll give me the edge, and then I'll be able to beat Dr. Lisle in basketball. Of course, back then he wasn't Dr. Lisle. He was only 9 years old, so he hadn't finished his doctoral work yet, but we called him Doug. So I adopted this diet, and unfortunately it completely failed because he also adopted the diet. And now here we are 47 years later. He's still kicking my butt. I'll give you an example. After weeks of practice, I decided to challenge him to a free throw shooting contest. We went out there. I hit 48 out of 50 free throws, and I thought, well, that ought to do it. He hit 19 free throws, missed one, and then he hit 80 in a row. That's right, 99 out of 100 free throws. Now, of course, I didn't congratulate him. I said, yeah, Doug, great. You hit 99 out of 100, but you missed one, and that's called choking. But my introduction to health and healthful living and nutritional medicine was actually a complete failure. But it did get me interested in healing. And one thing that's really interesting, we have something happen here at the TrueNorth Health Center with the use of diet and fasting that's really novel. It's actually almost unheard of in medicine because our patients, well, they actually get well. And that's not even part of the paradigm in medicine. Think about it. If you have high blood pressure and you go to a medical doctor, they're going to tell you that you need to take a drug or 2 or 3 or 4 or 5. And they're going to promise you that if you take the drug as prescribed and do exactly what you're told, that you'll be on those drugs the rest of your life. They'll guarantee you you'll never get well. You'll be sick forever. If you're on autoimmune diseases like lupus and rheumatoid arthritis, you're going to be told the same thing. You'll be on drugs the rest of your life, that you'll never get well. If you have diabetes, it's the same thing. So with conventional medical treatment, which is basically about drugs and, in some conditions, surgery, the patient never recovers. Now, it's really convenient for the pharmaceutical company because you have to be on those expensive medications forever. But it's kind of a tough business model when you think about it. You're going to give somebody dangerous and expensive medications, promising them they'll never recover. We have a different experience because in our approach, people are able to manage their conditions so they can eliminate the need for medication. They can actually get well. And so, that's why you're starting to hear a lot more about this type of dietary intervention as well as fasting. Because as more research is done, we find out that it's these kinds of interventions that actually make the difference in helping people recover their health.
Dr. Alan Goldhamer here on the John Mendola Show. Alan, for you, we continue to interview coaches and athletes all the time who've accomplished great things. Many of them do very well in the classroom and, of course, in their sport. However, maybe they could do a little bit better. And your recommendations for athletes to start to practice when it comes to their food and water consumption?
Well, one of the things that athletes want to be cognizant of is the fact that sometimes the things that might appear to be the most helpful over the short run aren't always the best strategy over the long run. And just because something might provide some short-term benefit in terms of athletic performance doesn't necessarily mean it's the best thing in terms of you getting healthy and happy. And, anabolic steroids are a good example. Many athletes get driven into utilizing performance-enhancing drugs because you can get from A to B a little quicker. But, of course, the price that ends up being paid can be really quite devastating. And the same thing's true in terms of our diet and lifestyle habits. We should be thinking about what we can do to maximize our overall health, even though sometimes the things you do to stimulate function might give you a little quicker response initially. Over the long run, you need to be thinking about short and long term. Unfortunately, many athletes, particularly young athletes, really don't think beyond, the next contest.
Dr. Goldhamer, when you see a lot of cramping in athletes when I'm out there at sporting events, tell us about the importance of water intake, types of foods that will help them obtain maximum hydration. And there is a little difference between if they're younger and when they're adults.
Sure, it's not just athletes, but, dehydration is like a major reason why you see people in emergency rooms. It's a major problem for athletes. Maintaining adequate hydration, of course, is critical. And unfortunately, as we know, just drinking water, as important as that is, isn't always enough to ensure, maintaining optimal hydration. And so it's important that we eat a diet that is high in the materials that the body needs, not only to get fluid in, but in order to keep it in. And that's where a diet that's high in fruits and vegetables becomes, I think, very important for all athletes. Fruit and vegetable diets are extremely high in water and also, of course, in the minerals and nutrients that are necessary to maintain optimum health and ultimately optimum athletic performance. And getting people to eat large volumes of fruit, salad, and steamed vegetables, I think, is an important issue for all people, including athletes.
When it comes to vitamins and supplements, that's not necessarily a recommendation from you, correct? It's they should be getting all those from their food?
Yeah, one way or the other, you have to get the nutrients that are necessary to optimize function because most people are eating really poor diets. They think the only answer is to take a lot of pills and potions. The problem is the pills and potions may be helpful, they may be harmful, in the long run, the best way is to do the diet. Now, there's an excellent book out written by Dr. T. Colin Campbell, a Cornell University professor, who wrote a book called Whole. And basically what he does is he really uses the scientific literature to make the case that taking nutrient pills and potions often does more harm than good, and that the real answer is to get those materials that we need from a diet that's high in fresh fruit and vegetables, steamed and starchy vegetables, and that minimizes the highly processed, refined junk foods that make up the majority of calories that people are eating.
Dr. Goldhamer, how about proteins? I think so many people are convinced that they need to have 40 or 50% protein, and that's not something you believe in, or a lot of the top doctors, Dr. McDougall, guys like that.
Yeah, there's no scientific evidence to support the idea of putting people on high-protein diets. In fact, excess protein intake is a major threat to health, particularly long-term. And so, yeah, it is true that you need protein for essential amino acids that are necessary to maintain health and function, and you need about 10 to 12% of your calories to be derived from protein. And athletes also need 10 to 12% of their calories derived from protein, but they need more calories. So it's not that athletes need to have a higher percentage of calories from protein in order to maintain optimal health and function. It's just they need to have, they're going to be burning more fuel, they're going to be eating more food, but it's the same food. It's just they're going to eat more than they would if they weren't getting their athletic performance. And so, there's no justification for putting people on 40% of calorie from protein diets, which tend to be protein derived from either highly processed products that people are trying to sell you, or large amounts of animal-based foods. And so what we advocate is people eat the diet that is designed to maximize health, and ultimately it does help with performance as well. It's just that, again, short-term pleasure-seeking, self-indulgent behaviors, like Dr. McDougall says, people love good news about their bad habits. So if you tell them it's good to eat all this highly processed food, then they're more than happy to believe you.
Dr. Goldhamer, no matter what age you are, whether you're 15 or 45 or 63, it's never too late to stop as far as your bad eating habits, and maybe get yourself involved somewhere like yourself, TrueNorth Health Center, to turn it around, and you might be able to reverse a lot of things.
It's amazing how forgiving the body is. We see that even in people in their 6th, 7th, or even 8th decade. If they are willing to do dangerous and radical things, like learn to eat good, learn to exercise, and learn to get enough sleep, the body's ability to heal itself is really quite remarkable. We see lots of people that have tremendous health challenges, but the body is able to heal itself if you do the right things. And so it's very, very encouraging. And if you're fortunate enough to do this when you're younger, you can avoid all of the problems that are becoming so common for people in our society today. It's really, in my business, we see a lot of people that, aren't willing to make diet changes or begin an exercise program until they're forced by pain or debility. But the people that I believe get the best are the people that actually do it preventatively. They're doing it, when they're fit, before they've compromised their health and health, because they don't have to work quite as hard as people when they wait.
Dr. Goldhamer, I remember hearing you say this once before, if I'm correct, or you said your blood pressure is one of the best indicators that you could have to see where you're at. And as that changes, as you improve by percentages, your health should be improving as well.
Well, the blood pressure is a very sensitive indicator of all-cause morbidity and mortality. And the reason is there's lots of different things you can do that screw yourself up that'll increase your blood pressure. For example, if you plug up your blood vessels with fat from eating a greasy, slimy, dead, decaying, flesh-based diet and highly processed foods, eventually atherosclerosis becomes an issue, and your blood pressure will go up. If you're on a really high salt diet, which increases your blood volume and pressure, that'll increase your blood pressure. If you have problems with your autonomic nervous system, that will cause tightening of the smooth muscles involved in the vessels, that can drive your pressure up. If you have problems with hydration issues, that can increase your pressure. So lots of different systems. Kidney disease will be associated with increased blood pressure. So because your blood pressure doesn't tell you where the problem is in and of itself, but it tells you there's a problem. If you make diet and lifestyle changes and you lower your blood pressure, you dramatically reduce your risk of all-cause mortality. For example, If your blood pressure is 150 and you drop it to 120, there's a 30% reduced risk of dying from any cause, not just from heart attacks, but from all-cause mortality. And what people don't realize is that healthy blood pressure for most people is actually about 90/60. There's been a number of studies looking at, optimum blood pressure. Now they say, well, what about 120/80? Well, that's average, and average people in our society are not necessarily healthy. So if you want to be optimally healthy, you want to drop your blood pressure to its optimum level, which is about 90/60. To do that, you have to be on a health-promoting diet. You have to minimize sodium intake. You have to engage in appropriate exercise and get enough sleep. And if you do that, blood pressure, including amongst hypertensive patients, will normalize. And as I said, in the study that we did with Cornell University and our colleague T. Colin Campbell, we took 174 consecutive patients with hypertension. We put them through a period of fasting and diet and lifestyle change, and 174 out of 174 were able to lower their blood pressure enough to eliminate medication. And in stage 3 hypertension, those with blood pressure that started at 180 or higher, we had an average drop of 60 points in blood pressure without any medication use. So that is the largest effect that's ever been shown. And people want to look at that study, they can go to our website, healthpromoting.com, go into the Learning Channel, and those studies are all freely available just by clicking on that website.
Dr. Goldhamer, one of the final questions I have for you is the levels of reaching that level of satiety. When you say, Dr. Lisle would say, I'm the freak as far as metabolism. We all know that person that could eat everything and maybe not so healthy on the inside, but maybe on the outside it appears that way. And then the person who may overeat at times, and again, the classic American diet, but they gain pounds quite easily.
Yeah, well, when it comes to the conventional American diet, remember 2/3 of people now are overweight or obese. So if you're not fat, you're now abnormal. It is abnormal to be fit. It is the exception. So you do not want to be normal. You want to be healthy. But to be healthy, you have to do the things that cause health, and that includes healthful living, diet, sleep, and exercise. And from our viewpoint, a healthful diet is a plant-based diet that's abundantly rich in fruits and vegetables, minimally processed grains, beans, nuts and seeds, these types of products, but minimizes animal foods and eliminates the highly processed oil, salt, and sugar that makes people fat, sick, and miserable. You need to exercise. It doesn't matter as much what kind of exercise you're doing, hiking, biking, swimming, it's preferably a variety of things to minimize repetitive injuries. But you need to do it. You need to do it regularly and as vigorously as is appropriate. And you need to get enough sleep. If you're waking up using a highly addictive drug like caffeine in order to get up and function, you're not going to be getting the rest that you need to maximize your health. Diet, sleep, and exercise, those are the things you can do something about. Those are the things that make the difference. You want to be healthy, you got to be prepared to pay the price. And the price for health is healthful living.
Dr. Goldhamer, how about a final step in what to do with your kids? If you have children and they're at a young age, try and incorporate, if they've been eating poorly for such an amount of time, how do you incorporate the healthy eating and making sure they're eating the foods that you recommend?
Well, I think the most important thing is set a good example. You make healthy foods abundantly available, and you create channel factors to minimize exposure to highly processed foods. You do the same thing with drugs. You don't just say, oh, well, kids are kids, 9 years old, have all the beer and wine you want. You can live on chocolate and cheesecake. We don't have to actually have you eating anything. You try to set a good example yourself. You make healthy foods readily available. You minimize exposure to the more concentrated foods. And you hope that your children with good example and education can make good decisions and not become fat, sick, miserable people like so many of the people in our society today.
Well, Dr. Goldhamer, I want to thank you for your expertise. One of the best guys in the business, that's for sure, to try to get you a little bit healthier. And, of course, we want to turn it around and get you a lot healthier, that's for sure. And I'm trying to do it myself and following a lot of your principles right now. TrueNorth Health Center, Dr. Alan Goldhamer, thank you so much for your time.
It's my pleasure. Thanks for having me.
Dr. Alan Goldhamer here on the John Mendola Show. We are driven by McCarthy Tire and Automotive Centers.